Hi, my name is Tristan Smolarczyk, and this is my reflection video for ATTR 455, in which I'm just kind of reflecting on my clinical site and my clinical experiences at Indiana State Track and Field and Cross Country. My preceptor is Dylan Highland, and honestly, he's been by far one of my favorite ones, right next to Cody Inskeep. This is my second time with Indiana State Track and Field and Cross Country. I was there for my sophomore year for 8 weeks, and I really enjoyed it, and I requested to come back, and I actually got placed again. I'm really enjoying it. I feel like I always learn something new every single time I get there. I'm learning a lot of new things, like how to handle when I have 7 patient encounters in a day, and how to document that differently every single time. And I'm documenting phone calls with doctors and stuff like that. So I'm learning a lot about my documentation and how I can improve it, as well as what needs to be included in it. And I'm learning a lot about how to interact with these doctors and the coaches. I've been thrown under the bus many times in which I had to go and talk to the coaches. And so that's always nerve-wracking because I had never done that before until I came here. And so I think it's really fun and interesting getting to interact with more than just your peers in class and the patients in the clinic. I'm talking with the team doctors, I'm talking to the coaches. Occasionally you have that one parent at one of the meets that wants to talk to you as well. So it's kind of interesting working with track and field and cross country. This past weekend we had regionals, and so I got to experience that. Cody kind of put me in charge of the med tent, which I had to document everybody that came in and as well as out, and what was going on with them, and if the doc had seen them. I got to also talk to a parent while I was there and help her kind of calm down her daughter. So it was a different kind of experience. It was a lot of fun, very cold, and I've been to several of these cross country meets, but I never just get put in charge of the med tent, so I thought it was really cool. I've never had a bad experience at Indiana State Track and Field. Everybody there is always nice, and they always have different backgrounds. Kirsten, Rob, and Dylan all have different backgrounds, different kinds of experiences, and different trainings, and so they all teach me these new things all the time, especially Dylan and Rob with their manual techniques, and it's a lot of fun. I've been learning MWMs from Rob the past few weeks, and I've been learning a bunch of new ones that I feel like I can implement more and more in practice. Dylan saw me a couple new tape jobs, as well as some new kind of PIVMs, and stuff like that. So I think it's all really cool, and I feel like I'm learning a lot. I've been implementing more rehab into our practice and doing a lot more preventative exercises, which we've taught the cross-country team at Hip Aquatics. Preventative exercises help with weak hips, and so I think it's pretty fun. We've just been kind of doing a lot of different things, especially with Cody out. We are kind of spread kind of thin. I know Indiana State Track and Field is used to having 5 student athletic trainers from when I was a sophomore to 3 last year, and now just me. So we're spread a little thin, and they can do their job without me, is what they always tell me, to make sure that I'm not showing that, so I'm not always having to go if I don't have the time or can't. And they completely understand my schedule, which honestly is great. I needed that. I need preceptors that just kind of understand schedules. I had a couple of really bad clinical experiences, but I'm enjoying this clinical experience in Indiana State Track and Field. I have 3 of my SIPs done currently. I'm pretty sure I actually have all of them done, but Dylan just hasn't signed off on all of them yet. But I have my establishing baseline patient data with SIP 1. I have SIP 9 done, both of them. They're both documentation strategies. This past week I at least got one of those signed off on, but I only have 3 I have left are the clinical evaluation modality and rehabilitation plan, which I'm pretty sure I've done, but Dylan just hasn't signed off on it yet. And then the 2 psychosocials with SIP 8. And so I'm getting a lot of stuff done. I have almost all of my clinical hours. I have 242, I believe. So I'm about 8 hours short from where I need to be. And so I'll probably get that this week. This past 3 to 4 weeks, I've gotten at least 20 hours every single week, so I'm definitely over 60 to 70 hours in the past 3 weeks. So I've been getting everything done that I need to get done with Indiana State Track and Field. I've really been enjoying my time. I can't say anything bad about this clinical site because there's nothing bad to say about it. We work hard. Everybody communicates really well, and the only thing I feel like I wish was communicating more was the time of regionals this past Friday, because I didn't learn about that until I got to class. But other than that, I think everything's going great. Communication, everything. Got nothing bad to say about it. Been learning a lot about how to fix my practice and make it better, and I mean that's what the DAT students focus on most, and since that's where I'm placed with a bunch of DAT students, I feel like I'm kind of using that more for myself as well. And so it's definitely a learning experience, it's definitely a lot of fun, and it's definitely a kind of sport I like to work with, so I'm definitely enjoying it. Alright, thank you.